Hi everybody. In today's video, we're going to go over a case study of somebody who was dealing with low back pain after a surgery a long time ago that healed well, but pain came back and radiated into the glutes and into the hamstrings, but never past the knees. So if this sounds like you or you're interested in learning more, I'll stick around and I'll show you what we did. My name is Dawn. I work at Performance Place Sports Care, just one part of the locally world famous chiropractors here in Costa Mesa, California, and I'm just going to hop right into this case. So this was an older gentleman who came in, kind of comes hobbling in because just walking does not feel good for this person. The longer that he walks, the more it radiates down into the glutes and into the hamstrings. One side is worse than the other, but it seems like both are always really bugging him. He sits a lot for work, and sitting for too long will also bother his low back and his hamstrings. So he describes it as kind of an achy pain, but sometimes just this sort of grabbing sensation in the lower butt cheeks and in the hamstrings when it gets really, really bad. Some movement makes it better, like some back stretches or some twisty knee exercises. And again, had surgery in the past, healed really well from it. But just is now dealing with some discomfort again and needs some help. So reminder, after a thorough examination and neurological exam, we found that these exercises were okay and safe and would work for him. Be careful at home. Make sure you see a health professional before moving forward with some of this stuff, okay? So I'm going to hop right into what first aid worked well for this person. So when we talk about first aid exercises, typically this means, okay, walking hurts right now, bending forward doesn't feel so good, bending backwards definitely doesn't feel good, and we come back to those things after we do a first aid and we see that there's improvement. And we dose a first aid out for about a week. We call it like antibiotics for an infection to just decrease sensitivity over time and feel like you have some control. So I'm sitting on this bench because the first aid for this person was to drag the hands down the legs, grab the ankles, and just lightly come back up to the knees, okay? Grab the ankles and come right back up to the knees. And we worked through just little movements like this first to make sure everything was feeling okay. We did 10 to 15 reps. We got up, we walked around, was feeling a little bit better. Nothing significant yet, but was like, yeah, I'm okay with that. I'm responding well. So then we reached all the way down to the feet. We use the feet and the ankles as a way to pull us into more of this stretch, okay? Hanging out in this position, letting gravity really take a tug here. Pull, 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 about 10 to 15 times, and then came back up, went for a walk, was feeling pretty moderately better. Did one more round of that, really thinking about not keeping a straight spine in this. It's actually, this person we could tell just needed some flexion in the base of the spine. So again, in this, making sure the butt is rolling backwards, grabbing the ankles and pulling. 3 rounds of about 15 reps of that, and it was significantly better. So that became this person's first aid. Anytime you're having symptoms, use that to control symptoms as well as dose it out really heavy throughout the week and see how you feel. Okay. If you have sciatic symptoms, nerve symptoms, remember this, just because this worked for this person doesn't mean it's going to work for you, but don't get discouraged. There's many, many, many ways to treat back pain, pain into the hamstrings. We just got to find the right recipe for you. If you want some more, tips and tricks, click on the webinar that pops up, and that'll take you through some educational things about low back and sciatica and different stretches and exercises that you can try. So the next thing that we paired for this guy is what we call a high diagonal sit, okay? Some people call this like a shin box. Call it whatever you want, but there was a specific way we were coaching it for this person, okay? Hips, glutes, all of that stuff was super, super tight. So we just wanted to work through a nice easy stretch that he could build into his day-to-day routine until symptoms got better. So we started off in this position, okay? Some people can be way up here. Some people need to be way back here. Find the position for you that feels all right. And all we're gonna do is start to work through how to put load into this front knee, okay? So we're just gonna lean our body forward. We're gonna press that knee into the ground. We're gonna feel a stretch into our glute, and then we're gonna use the knee, push ourselves back to starting position, okay? Again, roll the hip and the body over this knee. Drive the knee into the ground for about 50% effort. Feel the side of the leg and the butt cheek. Do some work here. and then use that knee pressure to push yourself back to starting position. 10 to 15 reps of that on each side, okay? Find a way to flip to the other side and do that again. Load over this knee, push into the knee, maybe hold for a little bit if you want to, or maybe bring that hand with you forward. There really isn't quite perfect in this one, which is important to have somebody guide you. We're gonna figure out what is correct for you. But if you're feeling a butt cheek stretch, you're probably doing it right, okay? And so again, we do it to a pretty fatiguing amount. This particular exercise was something that he reported what gave him the most long-lasting relief. This one was quick, easy, temporary relief to just reduce discomfort. This was, I had 4, 5, 6 days of not even feeling symptoms before it came back. So again, that is not long-term benefit, but that's huge progress for this person. And so we build off of this. This is a starting point. This is, now we know that what works, we know how to progress moving forward. Again, if this isn't working for you, if you can't find yourself in that position, if it just doesn't feel right, don't get discouraged. There's many ways that we can work through this. Click on the link, reach out to us, give us a call. We can help you virtually or in person. We'd be happy to start a discussion and just guide you down the right path.